Welcome back to the Pelvic Health Summit. I'm your host, Hannah Matlock, and we are here today with Mindy Pickard, an acupuncturist in New York City who specializes in pain management, fertility, menopause, and pelvic floor dysfunction. Thanks for being here, Mindy.
Thank you.
So can you first tell us what brings people into your office?
All kinds of pelvic pain. Vulvodynia, endometriosis, IC, recurrent yeast infections, prostate pain, penile pain, period pain, dysmenorrhea, and injuries. People have injuries and they hurt their coccyx and then it reverberates throughout the whole pelvic region.
So can you explain how acupuncture helps to treat these problems?
Acupuncture works on many levels. The first level that it works on is the neurological level. So the nervous system, we damp down the nervous system. And then it works on all the other systems of the body, including pain. It releases endorphins, and it works on the hypothalamus and the pituitary. So lots of different things are going on when you're having acupuncture.
And the nervous system plays such an integral role in pain and chronic pain that I think acupuncture is a way to really treat the nervous system and to calm the nervous system. Do people know that coming into your office, or is that something that you typically have to help them understand?
I think they know it intellectually, but if they haven't experienced acupuncture, they don't know it in their body. I think a doctor usually, or a PT usually recommends them and has told them that it'll help with their nervous system and with their pain. And then they come in and they experience it. And some people take a little bit of time. It takes a couple of sessions for them to really relax into a treatment. But over time, almost everybody tends to love acupuncture.
And I was about to ask you what type of results you see.
I see really good results. Usually, our patient population sees more than one practitioner at a time. They see a doctor, they see a gynecologist, they see a physiatrist, they see a PT, and together that collaborative group helps these patients to move past the pain and to regain their quality of life.
So are all of these various doctors referring their patients to you? Is that how patients typically find you?
Yes.
Through their other practitioners?
Yes, through their other practitioners. A couple of people find me through the web, because I do have a website, or they find me through other patients who might have experienced something similar, but for the most part, it's the doctors and the PTs.
So can you talk a little bit about how a lot of people might be hesitant to get started with these alternative methods to healing? I think a lot of people want to see a doctor and they want that doctor to be the only solution and to be the one solution to their pain. But we've talked with other therapists who have shown how therapy is also really important for healing pain. And it goes similarly with methods such as acupuncture and massage therapy that are tremendous aids to healing chronic pain as well. So what is some word of advice or a way that you can help everyone listening to understand this kind of multifaceted, integrative approach to healing pelvic pain?
So one of the great things about acupuncture is that it works on all the systems of the body at the same time, which is very unusual. Most modalities don't do that. So that's one of the things that we can tell patients, that they should try acupuncture because of that. So most of these patients, they don't just have pain and they don't just have anxiety, they also have GI issues and urination issues and lots of other sleep issues. So acupuncture can help. Within one treatment, you can work on everything. So everything gets addressed. It's also very safe. It's a natural remedy, and it has no side effects. except for maybe being tired or hungry after the treatment.
Right. And when people come to your office, what's the duration of time that they typically are seeing you for? Do they come once a week for 3 months or twice a week? What does this look like?
Unless they are in unbelievable pain, I recommend once a week for about 3 months. And then I try to move people to an every other week scenario. And then after time to a once a month scenario. Most patients tend to love acupuncture and they end up coming for a pretty long period of time, once a week. And typically a treatment lasts for about an hour, hour and a half.
And as you said, it's not just a method that treats pain, but it treats anxiety and it treats depression and it treats back pain, neck pain, anything that your body might have. So.
Exactly, and most pelvic patients, it's a complicated kind of a thing, so they usually do have some kind of musculoskeletal pain, and acupuncture addresses that.
Right, and can you also talk a little bit about the role that men play in using acupuncture as a healing modality? I know that a lot of men are hesitant to seek help. Women are hesitant as well, but they might not necessarily go to acupuncture if they have pain. So can you talk a little bit about the experience that you've seen men have and the results that they've had in your practice?
Yes. Men certainly are more reluctant to try something new like acupuncture. I think men on a whole are reluctant to go to doctors unless it's, like last resort. But once they do come in, men have a great experience with acupuncture when they are suffering from pelvic pain. So they are some of my biggest believers. Once they can relax into it, they really do enjoy it and they find it to be very effective.
And what types of symptoms do men have that you see?
A lot of men have penile pain, pain with ejaculation, pain from enlarged prostate, urination issues. It runs the gamut, pain from hernias.
Mm-hmm. And are they finding you the same way that women are finding you through other referring physicians?
Yes.
And they see similar results?
Yes. Here in New York City, we have a wonderful collaborative group of practitioners in the pelvic pain world. I don't think it's like this in other places, certainly not upstate or in New Jersey, where everybody's really talking and meeting about the patients and really giving a great collaborative, it takes a village.
And it's incredible.
It's incredible. It's incredible for the patient that they're getting communication between their practitioners. And it's also incredible for practitioners because it enriches our work.
And something that's so wonderful and unique to the work you do is you really do specialize in pelvic pain. So how does the work that you do as an acupuncturist differ from any other acupuncturist?
Well, first of all, I was trained in a musculoskeletal style of acupuncture called acupuncture physical medicine, which works on trigger points. So it's a very biomechanical Western way of thinking. So if you put that together with the Eastern part of the acupuncture, you've got a really powerful modality. The other thing is that I do work locally at the areas, which is something we don't learn in acupuncture school.
But this is something you learned.
This is something that I learned and I was trained in and now I practice.
And you probably see higher success rates in your patients since you're able to treat the area locally.
Yes.
Which not many other acupuncturists that I've heard of do.
No, I think that there might be 2 or 3 people in New York City who do it.
Wow. And for everyone who's listening to this, if they wanted to find an acupuncturist, are there any recommendations that you could make that could help them find the best practitioner for themselves? Some questions that they should ask, or any piece of advice that you have?
Sure, I would check to see if they did any kind of musculoskeletal kind of training, and there's a lot of that, trigger point, motor point kind of work. You can ask if they do needle locally in the area. I would also have them ask their physicians and their physical therapists to recommend an acupuncturist in the area.
Yeah. And is there any other pieces of advice that you have for everyone listening who may be interested in these complementary treatment methods?
Well, I think the thing that I see that I would recommend people to try to not catastrophize their experience, because I think that is what heightens the nervous system. So if they can use as many modalities as possible to lower their feeling of catastrophe, then that would be very healthy.
I think that's really helpful advice. And one other quick thing that I just thought of is that, as you said, you communicate pretty closely with doctors who are treating your patients. So I think that for the patients listening, it would be something really helpful for them if they are seeing an acupuncturist or they decide to see an acupuncturist, if perhaps their acupuncturist talks with their doctor and they know what muscles or what parts of the body might need to be treated on, and they can have like a team approach.
Right. Every time I get a referral, I email the doctor or the PT and I say, what are you looking for help with here? What muscles do you want me to address? What's going on with this patient? So even before the patient comes into the office, I know the story to a certain extent. And then I report back to the doctor or the PT. So it is collaborative, and so you're getting better care because of that. I think that's what we would all want from our practitioners.
Definitely. And you have happened to have a close relationship with a lot of these doctors in New York, but even if a doctor or an acupuncturist doesn't have a relationship, you
let them start it.
Right.
It'll enrich their practice in the long run.
And it's super helpful for the patient.
Yes. It's all about patient care.
Can you tell us, are there any other things that people can do at home that can help calm their nervous system in addition to acupuncture, or if they don't have access to acupuncture?
Yes. First of all, meditation would be my first thing to tell people. And you can certainly learn how to meditate with YouTube or other, with a book, or meditation is natural to human beings. We shouldn't make that big a deal about it. The other thing is an excellent diet. Eating an anti-inflammatory diet would be very helpful.
And something that I struggle with in regards to meditation, because I know how helpful it can be for pain, is the fact I try and do it, but I know that it's not something that you see results from. If you meditate one day for 5 minutes, you're not going to feel any different. It's a practice that you have to work on and you have to build over time and really learn how to become someone who meditates. And I think that's when you start to see the results, similarly to acupuncture. Your pain's not going to go away in one session.
Right. It's not magic.
Right.
It's a practice.
So how can you kind of instill in people that meditation will help, but they have to be patient with it?
I think you have to start with baby steps. 5 minutes. Start with 5 minutes every day. Then go to 5 minutes twice a day. And don't beat yourself up. It's just a quieting of the nervous system. It's just breathing.
So can you describe what a typical acupuncture session in your office looks like?
Sure. The person starts out on the table, and I take their pulse. And based on the pulse findings, I do a root treatment, which is very few needles, 4 to 6 needles. And it dampers down the central nervous system. I leave them for 15 minutes. Usually the patients fall asleep or they get a feeling of floating. I come back in, I take the needles out, and then I do what's known as the symptomatic part of the treatment. And here we would do distal points based on Chinese medicine theory, which are points on the feet and the hands. And we would do more local points, the perineum, the pubic ramus, points near the coccyx if need be, back points, hip points, lower abdominal points, all the local points that relate to the pelvic pain. The person would lay there for another 15, 20 minutes. Sometimes I would do electric stim on certain points, and then the points get taken out, and they get up and get dressed and they go home.
How do you decide if you're going to use a stim?
If there is a painful area in the back, especially near the spine, or a painful area on the lower abdominal area, I will hook up the stim machine. The microstim helps to release the endorphins even more. I would call it Uber acupuncture.
Are there any specific patient stories that you can share with us that could provide everyone listening a sense of hope and success?
Yes. Here's a story that I tell a lot of my patients. A couple of years ago, I was seeing a woman with a lot of pelvic pain. She had vulvodynia, and she was seeing a lot of the doctors and the PTs here in New York. She improved. She got over it. And then this year in November, she ran the New York Marathon. She trained all over the summer, and she ran the marathon successfully. Wow. So she went from being a pelvic pain patient to a person who now ran the New York City Marathon, and she's doing terrifically.
And I would assume that you see a lot of patients who have similar stories. That's an exceptional one.
That's an exceptional one. I mean, I'm not a runner, so that's like, wow. Right. But yes, I see a lot of people. It just takes time, but there is a lot of hope. And most patients do get better.
And I think it's so important to know that there's hope and to know that there's so many practitioners out there who specialize in pelvic pain, and there's so many different medications and people to see and things that you can do. Even if a few things don't work, there's so many more things that can be done, and to not forget that is so crucial.
Totally crucial.
Well, where can everyone contact you?
I'm downtown in New York. I have a website, www.mindypickard.com.
Amazing. Thank you so much for sharing this really important knowledge and for enlightening everyone on the importance of alternative medicine and how acupuncture can help heal chronic pain. Thank you. And for everyone listening, if you found this video helpful, please leave a comment below and share it with anyone else who you think may benefit. Thank you.